My name is George Gantsoudes. I'm a pediatric orthopedist here at Pediatric Specialists of Virginia, and I'll be talking to you today about club feet. Clubfoot is a very common condition in orthopedics. It occurs in about 1 in 1,000 live births. It can occur on one side or on both sides. Sometimes when it occurs on both sides, the deformities are slightly different from side to side. It is a very treatable condition. It's a condition that is almost always treated with serial casting. This is casting that is performed once a week where we do slight adjustments to the shape of the foot and place a long leg cast on your child. We generally use a type of casting material that can be removed by the parents at home to allow for bathing the day of the appointment. It is something that also is treated not just acutely with the cast changes, but with long-term bracing. The bracing is used both full-time for the first couple months after we start the casting to part-time, which is just night times only, until about age 3. There are people who have had this condition who have gone on to not just play, but excel in professional sports. There are Super Bowl winning quarterbacks, gold medal winning Olympic athletes who have had this condition and gone on to very successful athletic careers. If you're talking about what are the long-term consequences of a clubfoot, there are certain things that we can fix, which is the shape of the foot, and certain things we can't fix, which is the conditions that cause this in the first place. Your child's calf on the affected side will be slightly smaller than it will be on the other side, and their foot may look slightly different, but this is only to a parent's eye or a well-trained physician's eye.
I first learned that my son could possibly have clubfoot at 18 weeks pregnant on an ultrasound. They were doing his fetal anatomy and they saw something on it, and that was when I made an appointment to come in and talk to a doctor. My experience so far at Pediatric Specialists of Virginia has been very positive. You get a sense here that the staff really cares about your child and they do their very best to make him comfortable during the procedures that he has to have. So I would say that some of the challenges with having a child with clubfoot is really making sure that they're comfortable. Each week when you go for a new cast, there's a little bit of an adjustment period of them having their leg a certain way. And you know, I had the benefit of this as my 4th child. I'm sure it's pretty daunting for first-time moms who are really trying to get into the groove of being a mom at the same time. But you know, as far as things go, it really has not been too much of a challenge. It's something you get used to. It becomes part of your everyday routine. And again, the people here have been great and really give you some advice when you need it on what your next step should be.